Food Pantry 101, a guidebook, How to Nourish and Feed Your Community. Wendy DeShong Neuhaufen. Dedication. I dedicate this book to my son and my husband, a Vietnam veteran who has always been there, along this journey with me. Acknowledgement. I would like to acknowledge my staff and volunteers at New Direction Services, who have enabled me to stay strong and resilient in this anti-hunger industry. I thank Kate Asensio for the cover photograph. I also acknowledge the work of the publishing company consultants for their guidance in getting this book published. About the author, Wendy R. DeShong Neuhaufen co-founded New Direction Services, Inc. in 2000, a New York City nonprofit organization with 501(c)(3) status granted by the IRS, with her late husband, a U.S. Army veteran who worked in church and community architecture. As CEO, Wendy runs the organization, which also has a community food pantry. She taught grant writing at Long Island University Brooklyn campus. In addition, over the years, she assisted many organizations and entrepreneurs with their nonprofit management needs, including grant writing and teaching them how to feed and nourish their communities. Wendy was an executive at the Food Bank for New York City, a professor and curriculum developer in Paris, France, and has spent years teaching elementary and high school in New York and abroad. Her global community expertise is what makes her capable of putting pen to paper in writing this book. Foreword. This book is written to help anyone on their journey of feeding and nourishing their community. It is intended for those with a passion for helping their community and those who need valuable information and a suitable foundation to begin. My 30-plus years of experience founding and operating New Direction Services Food Pantry in New York give me the expertise and experience to share with you the ins and outs of this unique industry. I also have many years of experience and knowledge gained from working with the largest food bank in the world, the Food Bank for New York City, which enables me to make this process more understandable. Please continue to check in with your neighbors who may be experiencing hidden hunger and food insecurity and who may need your help. Introduction. Every day, more and more people are faced with a food crisis. The reasons are many: cutbacks in social services, job crisis, rising unemployment, economic instability, soaring food costs, fallout from the pandemic, and environmental natural disasters, floods, hurricanes, storms, earthquakes, fires, etc. People are buying food with their hard-earned money and medication from their food budget. They are forced to choose between necessities. Even a one-month crisis can create havoc and start a household on a downward spiral of borrowing that leads to more and more debt. They should be part of the food as medicine movement because this is what will reduce the growing health disparity gap. At New Direction Services, we promote this as much as possible with the limited funding we receive. We purchase healthy, fresh foods, mostly locally grown in New York State, and those that are organic grass-fed, thus supporting New York State farmers and producers. Everyone can suffer from food insecurity, especially since the pandemic threw so many people into food poverty. Working people often feel as much pain as other people. If their income is marginal, they may exhaust what they have between paychecks. An unexpected expense may create a redirection of the money allocated for food in their budget. Or they may suddenly find themselves without a job and lack any savings to fall back on. Even those who are entitled to unemployment insurance benefits have to wait 3 to 5 weeks for their first check. And social services for the working poor are often the target of the most extensive cutbacks. Seniors, veterans, disabled, and single-parent households are also struggling with food insecurity. But today, the effects of climate change should not be dismissed. Natural disasters such as hurricanes, tornadoes, floods, and fires have thrown residents of all economic levels in towns, neighborhoods, and cities into relying on food resources from community food pantries and the like. Here's what you will need to do to begin the process of setting up a food pantry or a community food center. The guidebook is just a guide. You can modify it however you need and make changes that may suit your situation and your community. Each state may have different guidelines for complying with certain requirements. Please do not ignore them. This book is based on my 30 years' experience working in the food and anti-hunger industry as an executive at the Food Bank for New York City and as the founder and CEO of New Direction Services, Inc., a nonprofit organization with 501(c)(3) status granted by the federal government in 2000. Community support. The first thing you need is community support. There's no point in trying to start a food pantry all by yourself. You can benefit from the experience of others and the diversity of their ideas. So, talk with people you think will be interested in helping. Tell them about your plans. 3 good sources of interested people are people in need of food. No one can tell you better what is needed. Social service agencies. Individuals working in social services have an awareness of their needs, concerns, and experiences. Community organizations. Members of groups, churches, and fraternal organizations can act as volunteers, make referrals, and share their experiences. From this group, call a meeting to form an organizing committee. You need a group, 4-15 people, to plan your direction and accept responsibility for the primary positions of chairperson, vice chair, secretary, and treasurer. When you meet, make sure everyone agrees on what a food pantry is. Discuss its basic function of immediate aid and consider what related services, such as counseling and referrals, may be needed. Working with agencies and people in the community right from the start will build a steady interest in the pantry's success, laying the groundwork for volunteer recruitment and information exchange. Service plan. Now that you have formed an organizing team and agree on your purpose, it's time to determine the CE of the operation and the other supporting details. Of the basic questions to be answered are: at area neighborhood community will be served options range from Saint Your Group to an unlimited area. Who will be served? Options range from seniors, veterans, families with children, disabled, LGBTQIA+, etc., or anyone in need. Where will the pantry be located? Options range from within a church to building a new space or renting a space. How often will you help? Weekly, monthly, etc. Who will do the work? Paid staff, religious organization members, or volunteers, etc. The first step, the need. The first step towards starting a food pantry or community food center is identifying families in hunger crisis who receive little or no assistance from existing sources in the community. Determining how great the need is the next step. Contact social service agencies, churches, mosques, synagogues, and local activist groups and ask them if there is a need for food that they cannot meet. Ask groups that say yes if they would work with other groups to meet the need. Also, ask groups who are meeting the needs. Perhaps they have a program that can be expanded or have the experience to share. Questions you may ask your group to determine what is needed. Have you ever given emergency food to needy households? Do PTAs give donations to needy families in the local school? Do we have the following: kitchen facilities, refrigeration, transportation, volunteer membership, storage space, access to printing, office supplies, postage, meeting space, advocacy programs. Who will run the first food drive? Who will develop operating guidelines? Nonprofit status. Having organized interested members of your community and created a plan, you should now seek nonprofit status. Religious entities may not need this status to operate a community food pantry. Please check with your CPA. The benefits of having a nonprofit status include increased donor incentive with tax deduction opportunities, sales tax exemption when purchasing equipment and supplies, eligibility for food bank membership, eligibility for various foundation, corporate, government grants, and other financial support. Keeping your nonprofit organized and operating effectively includes having the following also in place: a functioning board of directors with members of the community recruited from all demographics representing the community. An effective board consists of a president, vice president, secretary, financial director, treasurer, and members. Meetings should be held at least 4 times a year, and minutes need to be maintained. Annual financial statements, including audits and reviews, are part of the compliance that needs to be adhered to. Check what is required from your state office. To meet all these reporting requirements, you must have a bookkeeper, accountant, and a CPA to prepare these documents quarterly, semi-annually, and annually. Some churches have different reporting requirements, and you need to follow up with an accountant in your state. In New York, filing a CHAR 500 with the New York State Attorney General's office is an annual requirement to remain in compliance. The second step, space. The second most important step is to have a location or space and storage. The size of the storage space is not as important as what is done with it. Shelving and storage containers are needed to make the best use of the space. Any kind of available cabinet can be used. One group may have a space to be donated, e.g., a pantry, closet, part of a basement or hallway, an empty office, etc. To avoid transportation difficulties, it is best for storage and distribution sites to be close to each other or in the same space. The following are guidelines for storing food and grocery items. Choose a storage space with locking doors and no outside entrance. Store all grocery products away from walls and off the floor. Use freestanding shelves or leave space between items and the wall. Protect products from moisture by selecting a dry, well-ventilated area. Store non-food items on separate shelving units from food. Mark the date received on all cases of food and start a first-in, first-out system. Inspect all items. Do not use any that are bulging, contaminated, or leaking. Use non-toxic insect and rodent traps and monitor them regularly. Use thermometers and regularly monitor the temperature. For refrigerators, 35-45 degree, and for freezers, 10-0 degree. Maintaining your storage area. The storage area must be well ventilated. Good airflow helps keep storage areas both dry and cool and can help prevent insect infestation. Clean. Cleanliness discourages pests and protects food from contamination. Proper shelving. Food should be stored for at least 6 from the floor and 6 from the walls. This makes cleaning easier and prevents pests from attacking food. Metal shelving is also a must if you can find or build them. Trash. Do not put garbage cans in the food storage area because they may harbor pests. Cleaning maintenance. Clean up spills immediately. Sanitize regularly. Plan and set up a cleaning schedule for volunteers. Make sure no water rests below the refrigerator in the pan. Preparing food for storage. Wrap opened food in a moisture-proof wrap. Place in clean, sanitized containers and cover tightly to allow air to circulate. Do not overload the refrigerator and do not line shelves with foil or other material. Remember FIFO, first in, first out. FIFO also applies to the refrigerator. Fruits and vegetables. Check daily for signs of decay. The nutrient content of fresh produce decreases over time. Freezer storage, temperature control. Freezer temperatures should be 0, 0, or lower. Money financial resources. Create a budget. Along with a need for a space to operate from comes a need for money. But before you look for that money, you will have to know how much you need. First, consider your basic operating expenses. Operating budget. Do you have to pay any salaries or wages? How about rent or insurance? And don't forget telephone, utilities, transportation, and contracted services like accounting, legal, social media, marketing, postage, printing, and bookkeeping. Next, develop a budget to cover program costs, program expenses, supplemental food purchases, and equipment like refrigerators and freezers, shelves, computers, printers, phones, and other office supplies. Also, be sure to keep a record of all donated items and services. Fundraising. Even the smallest pantry can raise money to cover food pantry program expenses and to purchase additional food for distribution. How? Special events are sometimes the easiest way for small nonprofit organizations to raise money. Here are a few ideas. Ask friends, neighbors, or church, synagogue, and mosque members to donate items for a flea market. Sort and price items. Advertise on social media and in the newspaper. And sell, sell, sell. Ask a local business to get involved. Perhaps the local supermarket or convenience store will donate $1 for every $20 in merchandise sold throughout a couple of weeks. Ask a local celebrity to donate an item such as one of their hockey sticks. Purchase tickets and organize a raffle with the item as the prize. Host a party where attendees bring an item valued at $10 or more. Then use the donated items at a silent auction. Proposals, grants to foundation can also help to raise money for your organization. The easiest way to learn about this funding.money source is to research the Foundation Center at candid.org, and you can also purchase the Grant Writing 101, a guidebook at www.ndsbooks.com. Food. Sources of food. Where are you going to get an adequate supply of nutritionally balanced food for your households? As we have mentioned before, the food bank is an excellent source of many different programs, from government commodities to community gardens. To access these food sources, you only need to join the food bank located in each state by doing an online search. The other primary source of food is your community itself. In addition to the grocery products available free or at a minimal cost through the food bank, you can pursue both donated and inexpensively purchased food in your own neighborhood. Meet with store owners and managers to ask for their help. Ask for donations from restaurants, bakeries, convenience stores, grocery stores, delis. Many of these stores throw away hundreds of pounds of damaged or day-old products every week that could be saved for us by Pantry clients. Food drives. Another way to approach your community and give everyone a chance to participate is by holding a food drive. A food drive is one of the best ways to have an adequate and well-balanced supply of food for your pantry. It's an opportunity to request items you have trouble providing, like high-protein foods and personal hygiene products. Many food pantries usually stock their shelves by collecting food through community food drives. In a food drive, the participating group or organization gives out a list of the most desired foods. There is no one correct way to have a food drive. The purpose is to keep the food pantry well stocked, and a variety of methods may be used. The following are some possibilities. Schools can be asked to run food drives with students and parents. Local churches, synagogues, and mosques have been asked to run food drives with congregations. Daycare centers have been asked to run food drives among their participants. Local supermarkets have been responsive to setting up tables and asking for donations themselves or donating cans or boxes. Staff members of the hospital can be asked to run a food drive. A raffle. Organizations in the neighborhood might offer movies or dances to the community and ask for a food donation for admission. Advertisement of need through the radio or TV or internet via online social media outlets. Apartment buildings, tenant associations, or block associations have been asked to run food drives. Investigate the possibility of obtaining surplus commodities from local service agencies. Your imagination is the only limitation to the kinds of food drives that can be tried. November and December are very productive months because of the holiday season. People are more generous at this time of year. The summer is usually the lowest month. Besides donations from individuals, large companies can be requested to donate food or money. It is usually a tax write-off for them. IRS Tax Reform Act. It is important to send a thank you for all donations, food, money, etc. received. The food bank. Once you have a service plan and nonprofit status, you will want to become a food bank member. A food bank is a private nonprofit organization with a large warehouse operation for collection, warehousing, and distribution of food and household products to agencies rather than individuals. As a member of the food bank, you will be able to access a variety of food sources, educational programs, monthly newsletters, and online access to a host of services, including food programs. The food bank offers a variety of services in addition to traditional food programs. A few of them are described below. In New York City, the food bank warehouse is in Hunts Point, Bronx. In your state, check out the food bank located in your area through www.feedingamerica.org. The food bank in New York City, for example, often provides opportunities to access additional resources to cover food expenses. Applications are always available to apply for funding to cover purchased food and operations. Check out www.foodbanknyc.org. Distribution Day. How are you going to give this food to your households? On Pantry Day, hundreds or more people may be waiting outside your door at 8 a.m. for a 10 a.m. distribution. So, the more you plan, the smoother it's likely to go. There are two primary methods of distribution. While there are many ways of handling the actual event, it all boils down to either pre-packing bags, boxes, or having clients shop for themselves, customer style. Each method has its pros and cons. Pre-packed. Less confusion at distribution, easier ordering and planning, unwanted items given, more labor required. Customer style. Greater empowerment of clients. Special food needs are met. More space required, more organization required. Many pantry operators say that the pros of customer style well outweigh the negatives. In fact, the issues of space and chaos can be totally bypassed with a little planning. With the right methods, all the above negatives can be avoided. Also, the following important points should be noted. Have the available items stored on shelves lining the walls of the room. Group all shelved items according to food types or food groups. Place quantity limit signs on each shelving unit according to family size. Assign a volunteer helper to assist shoppers. Allow a designated number of people in at a time unless you have a large space. Offer an extra items or give back table for bonus items or exchanges. Regardless of what method you choose, please be considerate of the recipients. The conditions that cause a person to need your help are very stressful. Do your best to treat them with respect so they feel less embarrassed. But since COVID-19, the embarrassment associated while standing in line at a food pantry has almost disappeared. Food distribution basics. Pantry day distribution. The customer-style distribution has the following options. Food is placed on different shelves based on food groups, and customers come into the pantry area to shop with the help of volunteers. The other style is the window style, where clients point to the food they want by standing by the door or window. Inventory style is another method where a list of food is handed to clients while on the line. A volunteer then packs the bag for the client of what they check off. Many other sources of food pickup are newly available. Clients can select food from an online inventory list and are given an appointment to pick up their food. Clients must have a smartphone to participate in programs like this one. Many elderly clients do not participate in such programs because they are not smartphone or internet savvy. Food content considerations. When distributing food to your clients, the following must be considered, no matter what the method. Foods should be selected, when possible, that have the least sugar, lowest sodium content, lowest fat content, and no additives such as dyes, chemicals, etc. Food pantries have a commitment to providing good food for the people they serve. Food should not be unhealthy. The future of our society rests in the arms of the people who are feeding our most vulnerable community residents. Arrange food items in groups for easy access. Items should be stored in appropriate categories on labeled shelves, e.g., protein, baby food, vegetables, and low-salt foods. There should be a posted chart for volunteers explaining what and how many items to include to make up a food package. Food that must be protected from rodents. Food in bags, boxes, or other non-metal or glass containers must be stored in secure containers. If possible, a refrigerator is good for storing some perishable items. Baggies, plastic containers, empty jars, and coffee cans can be used to repackage foods. Paper, plastic bags, and boxes will be needed for food packages. Low sodium. Therefore, try to purchase and distribute low sodium products. Low fat and cholesterol. Many have obesity issues, so limit the products with high fat. Iron deficiency. This causes many problems, including anemia. Eating more iron and vitamin C balances the iron in our bodies. Add meat and beans to help with iron deficiency. Calcium. Calcium is a major part of bone and teeth development. Children need more calcium during their early development years. A pantry should provide many calcium-rich products, such as milk, cheese, yogurt, and fresh vegetables, when available. Food sorting basics. Packages. The following steps are useful for sorting food that comes into your pantry. Discard leaking containers, packages that have been spilled on, opened items, items with missing or opened seals, and unlabeled or illegibly labeled products. Separate remaining items into groups, such as human food and cleaning products. If you are sorting many goods, it may be helpful to group items according to packaging type, canned, bottled, etc. Examine products. If there is dirt, grease, or spilled food in the packaging, It may still be salvaged. Try wiping with a clean, damp cloth. Can. Dented cans need to be examined completely and discarded if severely dented. Some cans may also leak. They need to be put aside immediately, and the vendor needs to be contacted to pick them up on the next visit. In some cases, the cans can be opened, the contents thrown out, and the cans put into the recycle container. Swollen cans, sort and discard them. Cans with rusted tops, sort and discard. Another important consideration on Food Distribution Day is to make sure clients are aware of the rules regarding conduct and behavior while waiting on the line for food. Some instances, clients may skip the line, which may cause a problem for them. Having a coordinator volunteer manage the line to ensure a smooth process is helpful. In some areas in New York, police officers had to be called to rectify issues. In other instances, auxiliary community police officers are made available at the pantry during distribution days. You can check with your local precinct to take care of this issue. In other instances, auxiliary community police officers are made available at the pantry during distribution days. You can check with your local precinct to take care of this issue. Inventory control. Inventory control procedures. The goal of food pantries is to distribute food. Rapid and quick turnovers are the rule. If the food bank delivers food today, do not keep it in storage and add another delivery in front of it. You need to take inventory as often as possible and keep track of all products with a short shelf life. Sometimes, clients may complain about a product and the use-by date. If this is the case, establish a policy to ensure that their needs will be met. If the food comes from the food bank, you can do the following. Call the food bank and notify them about your concern for your clients and about the products ordered. If the food comes from another source, call that source and inform them of the problem. Food products should be dated when they enter the food pantry. If food is dated, there is never any question of when it came into the pantry. You can write the dates on the boxes or products as they come in. Products received are logged in the inventory control logbook, and delivery dates are placed on the items brought in, the boxes. Items that are taken out of the boxes are also written in the inventory control logbook. There is many inventory control software you can use, or simply set up a system on your Excel spreadsheet, such as date received, product name, total received, dates distributed, and total distributed. Food safety guidelines. Food safety is crucial in maintaining a clean food pantry and keeping clients safe. Since the pandemic, food programs had to adhere to strict safety guidelines. As a result, pantries continue to follow these safety precautions to date because it makes sense to keep clients healthy. Some guidelines are still practiced, such as masking up, sanitizing all the time, distributing masks when needed to clients, cleaning after each distribution. Social distancing, ensuring clients know the guidelines to be safe. Staff should use gloves when handling food, perishable and non-perishable. All empty water and juice cans should be emptied and put in the right receptacle after use by the person who used them. For safety and health reasons, unfinished beverage cans and bottles should not be left lying around office equipment or supplies. All opened food or snack bags should be emptied in the receptacle and not left lying around. Staff should wash hands after using the bathroom. Garbage trash should be put into the right containers as such. All recyclable items based on your local sanitation department should be discarded as such. Paper, cardboard, and electronics are recyclable items and should be discarded. Extermination pest control is crucial to the operation of the food pantry. A licensed exterminator should be hired to exterminate 3 to 4 times a year, and the work should be logged in the extermination logbook. Nutrition needs. Most emergency food pantries do not have the facilities to enable them to find fresh food, such as bread, chicken, fruits, and vegetables. Usually, they provide canned or boxed, non-perishable food, and the best food bags contain a variety of nutritious, non-perishable food. The food packages are planned to last from 1 to 3 days. To give clients a nutritionally balanced food package, information on nutrition will be needed. Nutrition experts can be found in schools, the health department, in college, university training programs, etc. They can be hired staff if you have funding, or you can have them work as interns to fulfill their college degree requirements. You can also contact local senior organizations to find retired seniors with experience who can volunteer their time. A nutritionist/dietitian will be able to help you develop a chart of food categories and how much food from each category to give for the number of days the food package will cover. For the number of days the food package will cover. The total amount of food will vary with the size of the family, but every family should receive food from all categories. Food items include protein foods, canned meat, fresh and frozen, fish, beans, peanut butter, baby foods, formula, soup or canned stews, low sodium, pasta, rice, cereals, whole grains, canned, frozen, fresh fruits and vegetables, green and starchy, powdered, canned, and UHT milk, 1% fat-free, low-fat, fresh milk if possible, canned and fruit juices that are 100% sugar-free, no sugar added. Remember to take into consideration the dietary habits of people in your neighborhood. If there are seniors, people with hypertension, or with diabetes, you may want to have foods that can be chewed easily or are low in salt or sugar. Many ethnic communities have distinct food preferences that should be considered when preparing food packages. Consider halal foods and kosher foods for those households following those dietary laws. Laws. Fresh fruits and vegetables are always the goal when funding is available or when the food bank has them in its inventory. The best way to keep fresh and healthy food in the inventory is to provide foods from the My Plate Guide and consider the following factors: family size, cultural food preferences, dignity of individuals, infants, babies in the household, special dietary needs based on diabetes, heart disease, etc., low salt, sugar, fat-free, etc., cooking challenges for the homeless, migrants, etc., flip-top cans, ready meals, etc. Check with a nutritionist or a dietitian to work with you on this distribution menu. Food groups. Providing healthy, nutritious food has to be a top priority. You want to give your clients food that will increase their energy level and promote good health, not just fill their bellies. The best way to do that is to provide foods from all of the food groups and to encourage people to eat a well-balanced diet high in grains, vegetables, and fruits while low in fatty foods and sweets. The basic food groups and their recommended daily servings are as follows. Grains, 6 to 11. Breads, whole grain recommended, hot or cold cereal, whole grain flour, cornmeal, etc., spaghetti, macaroni, etc., rice, brown, recommended, etc. Fruits, 2 to 4. Fresh apples, bananas, oranges, etc., canned peaches, pears, and pineapple, dried apricots, raisins, etc., fruit juices, 100%. Vegetables, 3 to 5. Fresh vegetables, all colors, potatoes, carrots, onions, canned corn, green beans, etc., frozen vegetables. Protein 3 to 4 OZ, fresh frozen poultry, canned tuna, chicken, etc., dried or canned beans, peanut butter, soy, and sunflower butter, eggs, dairy 2 to 3, non-fat dry milk 1%, fat-free milk, low-fat yogurt, cottage, low-fat cheese. Client overview. We have talked about getting started, finding resources, and staffing the pantry. Now it's time to look at the people who need your help, people with food insecurity challenges. The best way to start is by establishing a written policy that states who you are going to help, what you will provide, and when. You should include an equal opportunity statement like this one. For example, it is the policy of your food pantry to provide equal assistance to all qualified persons without discrimination on the basis of race, color, religion, gender, sexual orientation, age, ethnicity, immigration status, national origin, political affiliation, veteran status, or disability. The policy should be posted at the pantry, where everyone can read it or hand it out to each person when they register for the first time. A copy can also be given to any agency that may refer people to you. Next, you should set up an intake, interviewing, application process, so you can determine the needs of each client and how you can help them. Since the pantry may be the first place they have turned to for help, you want to be thoughtful and thorough. Many food pantries have these policies posted or handed out when clients come for the first time. The intake interview application process. When you are interviewing a new customer or client intake, you will want to find out as much as possible about the client or family so that you can provide other services. You may also need to have a listing of resources from the community to refer clients to. The application process can be approached in two formats. Paper application. The new client receives the application form at the entry to the pantry. Determine if the client has the documentation needed. Assist in completing the form and checking off all services required. The client is then given food pantry bags. The client is also given flyers for workshops, etc. The client has to sign your signature sheet correctly. Their next visit is the following month. The client is given the monthly return date slip. Computerized online applications. Computerized online applications exist and are designed with ease of accessibility to enable clients to complete an intake form online, which is designed by the food pantry. You can determine which is best for you, but understanding each process will help you determine which one you should choose. These are the documents clients can bring to their interview intake. A photo identification card, driver ID, non-driver's ID, passport. Documentation of need. In general, any documentation of need from this list is okay to bring. It may not be necessary to show more than one to prove the need. But since the pandemic, this documentation may not be necessary to prove need since everyone has experienced some form of need, and it continues to this day. Medicaid, Medicare, disability letter, letter from MD indicating homebound status, unemployment stub, letter, public assistance, card, work release card, senior citizen card, food stamp card, low-income pay stub, college ID, WIC card, referral letter from local social services agency. Some pantries require documentation showing homebound status, which allows someone else to come and pick up their food. clients need a letter from their medical doctor or government benefits card indicating homebound status. Some pantries also create their own letter, which will then have to be signed by the homebound person and have a photo ID attached. Referral process. When you are interviewing a new client, you want to find out if they have any immediate needs other than food so that you can make a referral if you do not provide the services at your facility pantry program. This includes whether they are receiving food stamps or WIC and work toward other areas such childcare, housing, employment, mental health, medical coverage, clothing, utility bills, money management. Legal assistance, drug and alcohol counseling, education, language issues. Also, have them contact their social service agencies locally. Customers' clients' guidelines. You must also establish guidelines for each customer client to follow. For example, operation days and times must be posted outside the entrance to the pantry. Customer care. Guidelines must be posted or handed out to each client. Address. The address cannot be changed without notifying clients. Services offered. This must be clear as to what other services are offered. Types of referrals needed. This is either from social service agencies or others. Types of identification needed. Must be clear what they need to bring. How often you can use the pantry program. Most pantries offer services once per month. Clients should understand that they must use other pantries for food resources and that they cannot just use one pantry for all their food needs. A flyer can be posted on the door. An application form is made available to those who need it and for those who qualify based on the application criteria. Client policies. Some pantries have client policy guidelines posted and handed out to clients on their first visit. Some pantries accept online appointments. You determine which is best for your pantry's needs. New customers coming to the pantry for the first time will be serviced when they arrive through an appointment or after all clients with appointments are serviced. Returning clients' customers must bring their appointment tickets to be serviced. Because of the time waiting in line for food, preference may be given to those with physical handicaps. All clients' customers are given an appointment ticket for once per month food pickup. Sometimes clients can come more than once per month for an emergency. All clients' customers must bring a shopping cart to collect food packages. Because of limited supplies, food supplies are given to one household and not individuals in a household. Staff will check the required documents. Please respect them. Clients' customers who display disorderly conduct will be asked to leave. There is a no smoking, cigarettes, vapes, etc. policy while waiting in line. There is a respect our neighbors policy not to sit on cars, porches, etc. while waiting. There is a respect the neighborhood policy not to litter. Mind your children when they come to the pantry. No soliciting is allowed in front of the premises. Do not come to the pantry as early as 1 to 5 hours before it is open. Do not disturb the neighbors with loud noise while waiting online and be respectful on the line. Record keeping. Overview. Why keep records? Records of what? You will be surprised how useful it is to simply record the number of visits a client makes and the number of people in that family. Record keeping can be that simple. This easily accumulated information can then be used in a report or newsletter to draw more support for the community. Statistics like this document the need and move people to act. Try using these numbers in the title of your food drive flyers. For example, 200 seniors or 90 veterans in this community don't have enough to eat. This makes the need personal and compels people to give. Record keeping can be more extensive and is sometimes required. There are several food programs administered by the food bank that require specific forms. You will be given both the forms and assistance completing them when you become a food bank member. These forms, along with monthly surveys, help create hunger statistics for the city, state, and nation. Those numbers are, in turn, used for awareness, planning, and fundraising. A monthly statistical analysis is required by food banks everywhere to capture the number of client households that receive food from the food pantry. Presently, many other surveys are completed online to document demographics as well as other information. Record-keeping guidelines. A suggestion to get you started is to utilize the client intake or interview form. Not only will it be a place to record information, but it can also help guide you through interviewing a new client and use that information as needed. It should include the following information: date, names, and ages of all household members, mailing address, telephone number, source and amount of income, client's other needs and possible referrals, identification type, driver's license, etc., client signature. Another good tool to have is a 3x5 or 5x7 index card for each client where you can record the date each time they visit the pantry. In the upper left-hand corner, put their last name and first name. Skip a line and input. Children, 0-17 years. Adults, 18-59 years. Seniors, 60+ years. Under that, divide the remaining space on the card into 1-inch columns to record the pickup dates. A card like this will make it easy to count the number of households and people you have served both for your records and for any monthly report. For those with the available means, you can develop a spreadsheet database on your computer. Records of the clients and records of food purchases need to be kept for up to 7 years. Records such as invoices and check payments must be kept on paper or scanned for that duration. Many food banks require that all records be kept on site for up to 5 to 7 years so that you will not be caught off guard in the event of a surprise audit. Compliance. Annual visits. Food pantries are usually visited annually or more to check on compliance. These visits are done by the food bank and any other agency that provides food resources to the program. They also check food safety, storage, delivery issues, signature sheets, sanitation, record keeping, food and nutrition standards, and answer questions that the agency may have about operations. Volunteers. Volunteers are the people who keep the pantry going on a day-to-day basis. Their primary goal is to have everyone working together happily and effectively for the benefit of the whole community. Do not turn away anyone. Everyone has something to offer. Volunteers can be recruited from community colleges or senior agencies. They should be trained in how the food pantry operates and how to prepare food packages for distribution. Volunteers should be asked to make a specific commitment of time so the lack of staff doesn't interfere with the pantry's work. Recruiting your first volunteers to fill positions will not be the end of the work. It is also important to fit people's skills with their activities. In general, ask new volunteers what type of work they have done before or what activities they would enjoy. Even before the pantry begins, you will need volunteers or staff for the initial work. Intake. Interview clients, complete forms, maintain records, and refer clients for other services. Development. To plan events, develop resources, seek more food sources, and recruit volunteers and interns. Physical work pantry helpers. They load and unload food from trucks, clean storage areas, repack food from boxes into smaller packages, maintain the line, pack food on shelves, and pack bags for clients, etc. You may need to find volunteers to create flyers and posters to advertise various events and services. These tasks easily break down into a dozen different jobs, each requiring 3 or more hours per month. The time commitment required of your volunteers will be determined by how many people are available to share the work and how often you distribute. Volunteers should be trained in food safety and receive the certificate offered by various health establishments, including for New York City, City Harvest, Food Bank, NYC Department of Health, or United Way. Clerical, manual labor truck offloading, help packing shelves, writing ability communication, maintenance, repair ability, handiwork, cleanup, language translations, client registration. Rewarding and retaining. With volunteers, it is important to have regular meetings to share stories about successes, to find out what they need, and to celebrate their efforts. These meetings can also help identify where folks may need to be shifted around a little for the best fit. Your primary goal, after all, is to have everyone working together happily and effectively for the benefit of the community. When working with volunteers, don't turn anyone away. Everyone has something to offer, and at regular meetings, you also determine needs, reward, and celebrate their commitment to the community, analyze work patterns, and make changes. Some policies to think about for your food pantry. Equal opportunity policy. Fair and consistent hiring, promotion, and salary administration practices that comply with the equal opportunity policy should be considered and put in place. Annual statistics. This document is prepared by the program staff with the guidance of the director and includes the total number of children, adults, and elderly served during the year. It also summarizes the total number of meals served, total bags of food distributed, total number of volunteers, and volunteer hours served during the year. You can also analyze the total number of people receiving the different services offered during the year. Annual financial statement. These filings must be done annually by an accountant, 990, etc., Char 500 in New York for the New York Attorney General's Office. Conflict of interest. The purpose of this Board of Directors policy is to protect interests when it is contemplating entering into a transaction or arrangement that might benefit the private interests of an officer of the organization. Compensation policy. This must be in place to comply with your board guidelines. Document retention and disposal. All documents are required to be retained for a specified period based on state requirements. Diversity. Policy shows a commitment to serving and reflecting on the community, especially on the board, advisory board, volunteers, interns, etc. Finally, your work is completed after reading this book. Hopefully, you will take this information and apply it where you see fit. You can now begin the process of setting up a community food pantry to help the households that are categorized as those suffering from food insecurity. For more information and guidance and consultation, please reach out to us at wendy@gmail.com.